I figured out that I wanted to be an interventional cardiologist probably when I was much younger, when I was 16. My parents basically had suggested that I would try to give back to the community by joining a volunteer ambulance corps. And when I was on that ambulance corps, I was introduced to things called heart attacks. So I am an interventional cardiologist, and my areas of interest include working on heart disease, specifically coronary artery disease, and also working on the arteries in the leg, so peripheral arterial disease. Generally, they'll present with things like chest pain or leg pain, even things like chest pressure, chest tightness, maybe it's just shortness of breath, things like that. Even though I'm not necessarily a surgeon, I still do perform procedures on the heart as well as the legs. I perform heart catheterizations, which is basically a procedure in which we take a catheter and inject contrast through it, and it helps us determine whether or not there are any heart blockages. I do the same thing for the legs, where we determine whether or not there's any blockages that need to be ballooned or stented or stuff like that. That first interaction that I have with my patient, I want to try and build a relationship with them. When I sit with them in the office and talk to them about some of the things that we want to do together as a team, so I want them to understand both what the next steps are, why we're doing them, and how we plan on getting there. The ability to sort of help someone in a very acute time period, very short time period, and to watch them come in an excruciating amount of pain and see that pain sort of dissipate after we've opened up a blockage, placed a stent, it means the world to me. Decompressing and relaxing, those things can be quite hard to define. For me, the most important thing for me is to see my kids.